5 countries account for over 70% of total death in a pandemic that has spread to over 200 countries and territories. Italy, US and Spain have lost at least 15,000 persons each to the virus. In the meantime, the World Health Organization has their job cut out in mobilizing the world for a united resistance against the virus. More than 4 months after the outbreak broke out, first in Wuhan, China, and then other parts of Europe, America and Africa, the WHO says efforts to find a treatment is accelerating at incredible speed. The body is also concerned about brewing diplomatic feuds and attempts to politicize the pandemic.
So more than ever before, national unity is important if we care about our people, if we care about our citizens. Please work across party lines, across ideology, across beliefs, across any differences for that matter. We need to behave. That's how we can defeat this virus.
Back in Nigeria, testing capacity of the Nigeria's authorities has been a source of concern. While they seem comfortable, there are views that the number of infections remains low because of relatively few tests carried out. The Nigerian Red Cross believes that universal testing of Nigerians remains the best approach, especially as symptoms of the virus do not manifest early. Moyo Thomas reports.
Scientists around the world believe the figures on confirmed cases may not truly represent the number of people positive with a viral infection. They believe the criteria to get tested is too stringent. Nigeria is one of the countries doing targeted testing.
If we limit the testing to only those who have come from outside and those who have made direct contact with them, we might be missing some cases. It's a good starting point, but I do believe that for a healthy Nigeria, universal testing.
We have 200 million citizens, and mass testing is not something I think is very feasible now. So we are doing targeted testing, targeting those who are likely to have been affected. So therefore, we're looking at areas and at persons who meet certain criteria that we set. Criteria of having been abroad, or having been in contact with people who have been abroad, or having been in a cluster of places where we have a lot of positives.
But
so that's the best. We are calling it smart. Yes, even though it's going into secondary, we are doing what we call smart testing in order to identify the cases that are giving us concern.
Testing kits are in scarce supply because of the high cost of production and rising demand for it worldwide, and is why many countries have opted for targeted testing. Recently, the Nigerian government announced that it now has the capacity to test about 1,500 people daily. But many believe the small number of confirmed cases in the country indicates that Nigeria is still under testing. Statistics so far show that Nigeria has one of the highest percentages of recoveries and lowest fatalities worldwide. But the major worry is if the number of confirmed cases truly represents all those carrying the virus who need to be brought in and treated early. Universal or mass testing of people have been employed by many countries of the world in the fight against the continued spread of coronavirus pandemic. Now that Nigeria is experiencing the secondary spread of the virus, it is actually time to consider universal or mass testing. Moyo Thomas, TVC News, Abuja.